I think I'm going to try and stay for the rest of the morning, if that's okay, just to listen to some of the conversations. It's really helpful. For those of you who have not met before, I'm Hayley Moore. I'm Deputy Director of Safeguarding and Closed Cultures at the Care Quality Commission. And I am here today to talk about the role of CQC, and hopefully we'll pick up as I go through this presentation of some of the points Michael referenced in his presentation. Can everyone see the slides okay? Fantastic. Okay, so today I'm going to cover a few things. I'll talk a little bit about our vision, purpose and commitments. I think that's probably particularly important at the moment because, you know, given the article, for example, today, I think there are concerns about our level of visibility and the amount of inspections that are ongoing at the moment. So I think looking at those commitments and where we're looking to get at too will be quite helpful, hopefully, for you to be aware of that. I'm going to talk quite a lot about the role of regulation when it comes to organisational abuse. So where does CQC fit in that wider landscape of roles and responsibilities, and how can we all work together? I'm going to reference how this links to culture, including closed cultures, and I'm sure many of you will have seen the guidance that we published post Walton Hall and how we look at that as a regulator. I'm going to briefly reference a couple of safeguarding adult reviews. I'll not go into that in too much detail because Michael has already gone through quite a lot. And finally, I'm going to talk about the importance of speaking up in terms of organisational abuse and how we consider that as the regulator when workers get in touch with us to raise concerns. So in terms of our vision and purpose, well, why does CQC exist and what impact will we have? So we're the health and social care regulator in England, and we're here to make sure everyone receives safe, effective and compassionate care. So we exist because of a set of legislation, and it is that legislation that gives us our powers and guides us as to what we do in terms of our role and remit. But our first purpose is always directly to people who use regulated services, and that should guide whatever it is that we do in terms of our work. So as you'll again probably all be aware, it's actually been quite a challenging time for us as the regulator over the last couple of years, and there has been some fairly critical reports about how our transformation has gone. And at the moment, we're trying very hard to get ourselves back to where we need to be in terms of delivering and what we need to deliver on. And there's been a huge amount of engagement going on both within CQC and external to CQC to guide what we want to do. And that has led to very much us resetting our commitments for the future in terms of what we want to do. So in terms of the public, it's really important we listen to people. We receive thousands of pieces of information every year from the public, from workers, from our partner organisations, and it's really important that we listen to that well. And also, one of the things we do really need to improve on is how well we feed back to people about when they raise concerns with us about what's actually happened with that information. We've got commitments to providers about how we should be supporting providers to help them improve and innovate. Whilst we're certainly here to hold providers to account when necessary, it's also really important that we're there in terms of improvement as well. It's not all about enforcement within CQC. It should be working with everybody around that vision of ultimately us getting really good quality care. And amongst that, you'll see we've gone out to consultation about a new assessment framework. As a regulator, everything we do has to be informed by evidence. So that framework by which we use to basically, look at the regulations and set ratings for services is really important. We've also got a commitment to our own staff within CQC because we have a responsibility to make sure our staff feel valued and are able to show up and do their best work. I think if our inspectors are well trained and competent and confident in what they're doing, including in partnership working, they will do a better job when it comes to engaging with providers and undertaking assessments. So it's really important that we're investing in our staff. And then finally, we've got a commitment to colleagues, our partners who share our purpose. I think, things like today are really important in terms of how we all working together We all have this same shared vision. Today we're talking about organisational abuse, and that is one thing across the system we all have in common. We all want people to be safe and to have good quality care and to feel listened to. And I think the more we can work together, the better to be able to achieve those goals. So I'm not really going to go into this because I think we all know this definition really well, but it's just there and up on the screen. And I'll move on just to talk a little bit more about what are the types of things we're thinking about at CQC. So as a quality regulator, we get all this information about services. And we're in quite a unique position because we get all the notifications from services as well as people, including partner organisations and local authorities contacting us. And Michael referenced before a piece of joint research that we've commissioned through the Expert Reference Group on organisational abuse that's been contributed to by the Safeguarding Adult Board Chairs Network. And it's really important that we start thinking about this threshold and not seeing safeguarding as something separate to the provider concerns process. So in effect, how do we take, for example, individual Section 42 inquiries or grumbles and concerns that are being seen on the provider concerns and have that real shared view of quality? And then within that shared view of quality, how do we at an early stage spot the deteriorating service? Because what we often see is those warning signs. Those warning signs are often there, and we collectively need to see them and then think in terms of each of our roles, what can we do to intervene early? One of the things I'm very passionate about within CQC is actually how do we spot those signs early and do appropriate regulatory interventions at an early stage. Because it's much easier for all of us to be engaging with the service as it moves from that good to requires improvement kind of level to when we see inadequate services where there might be urgent enforcement action going on, there might be potential criminal investigations, there might be the need for safeguarding adult review. Once that's happened, we're really in crisis, and it's how do we avoid the crisis and start, shifting that dial, moving it forward, having that shared view of quality, and working together because, actually we will achieve much greater things if we're all coordinated and we're all on the same page with what we think. I think before I did this role, I worked in an operational role, and I have been involved, unfortunately, in quite a lot of urgent enforcement work. And when these things happen, it's difficult if everyone is in a different place with where they think the service is at, including the provider themselves. So again, when we see those warning signs, if we can all start working together quite early, that's probably the most effective way we can go about things. And as it always comes back to communication and relationships. How well are we communicating? Because most things we can tackle if everybody knows that there's a problem early, and we actually think about, well, what are the mechanisms by which we come together and use all our respective mechanisms to be able to drive things forward. And the other thing there is, again, back to this collation of intelligence. So you can have this huge amount of information flying around a service. The police might have some, CQC, we have some, we have our individual Section 42 safeguarding inquiries around individual people. But actually, what does that mean as a whole? And are we looking at some of those warning signs of closed cultures as well? Like, is it a care home, for example, that the leadership's isolating themselves? Doesn't particularly want to engage perhaps with the local authority, isn't perhaps engaging with other providers in the area proactively. We see Kingswood, for example, which is an example I've got further on, in the presentation, where we see this sort of like disengagement from the wider, landscape within an area. And, there's warning signs there that we have to think about. So in terms of our role in identifying organisational abuse, in Section 3 of the Health and Social Care Act, we have a main objective, and that's to protect and promote the health, safety and welfare of people who use health and social care services. So that takes, protect and promote the health, safety and welfare of people. So if you think about organisational abuse, this is really at the heart of what we're about as an organisation. We are here, to stop that happening as much as is possible. And we do have this really quite unique position of holding all this intelligence about services. And I think we have to really get ourselves back in the position that, we were really strong at, a couple of years ago, which is, bringing that intelligence to the table. I think probably our biggest barrier at the moment is the age of ratings. So, Michael, you're talking about lots of good and, outstanding ratings, for example, but then you have to consider, well, how old are the ratings? How up to date is that picture of quality? So a really key thing for us at the moment is getting the levels of inspections back up. Just to give you an idea, I think when I was in operations in 2019, we were publishing 1,400 reports a month. And we have to get ourselves back up, to those types of inspection levels, I think, to get the picture updated. And there's a lot of work underway to achieve that at the moment. So I'll not go into this too much, but you can see that this concept of, all the different people who are involved. And I think when it comes to organisational abuse, it's not just, I suppose, professionals and the regulator. I think it's really important to think about the people as well out there, the public, advocates, all these people that are around a service. We need everyone to have the awareness of the signs of close cultures, awareness of the signs of abuse, of organisational abuse, and to try and build that psychological safety for whoever you are, that to speak up and to share those concerns, and for us to think about the mechanisms by how we put that whole picture together. That's really critical, because this is everybody's responsibility, and the more informed, relatives are about what they can do. What we often hear is relatives feel really quite concerned about speaking up or complaining because they get really worried that they'll get treated differently, or their relative who's receiving care will get treated differently. And we have those concerns raised to us, CQC, about when we're following up concerns, might you identify the person who's concerned? Then will they be, held to detriment, whether it's a worker or whether it's a member of the public, raising concerns. So these are real things that we need to think about. So I'm conscious of time. I'm quite behind on this, so I'll try and speed up a little bit. But for us at CQC, again, this is this point about hearing people's voices. It's really critical that we as a regulator are listening to people well, and people's voices at the heart of regulation. So that's both in the planning, but it's also what we're doing actually when we're on site. It's about really focusing on things like observation. We do have specific observational tools like the short observational framework for inspection. But it's really important that our inspectors are not in an office somewhere just looking at paperwork, that it's about really being out there, talking to people, talking to the staff, and really understanding what's happening, but then acting, if there's a problem. I mean, this is an interesting one. It's easy to see the individual tree. Have you seen the forest? And that was something one of our inspectors once said to me when I was doing some research. And I think this is a problem for all of us. It's very easy to see an individual piece of information. If you have a safeguarding concern about an individual, you can see that it's quite tangible. What is much harder for us to do is for us to join the dots and put all this information together when lots of different people hold that information. And you can see it really in what Michael's been talking about this morning, time and time again. It's our Swiss cheese effect. We've not joined the dots. Things slide through the cracks. We don't see it. We don't realise that deterioration is quite as serious as it is. So within CQC, we have a concept of what we call regulatory risk, which is the risk to people in services around the quality of care. And that is very much based on what is the contextual information about the service. Things like, what are the number of falls, how many safeguarding incidents are happening and what's the context behind them? How is the provider learning from information and things that are happening within their service? And Michael again referenced before service user to service user or resident to resident abuse, where again, if we don't see these low level trends, we often see that before a really significant incident where somebody's harmed by, another resident in a service because the risk hasn't been mitigated. But there's often opportunities before the more serious event to have acted and to have mitigated some of those risks. And this probably is one of the things that, from my perspective, I feel the most strongly about, that it is again very much about how we all work together. Um, whilst we absolutely, the local authority is responsible for the safeguarding, we also have to manage that regulatory risk. We have to think about, well, what does this individual thing that's happened mean for everybody else who's using this service? So I suppose it's that sort of concept that if we get told, for example, there's been a near miss where somebody with dysphagia is nearly choked because they've been given the wrong diet, our role as a regulator isn't necessarily around that individual. It's about thinking, well, how is the home managing people's dysphagia? So for anybody who's got those needs in the home, what does it mean for them? What is the safety, quality issues around them? And we have a responsibility as a regulator to always be considering that and acting regardless of what any of our other partners are actually doing or the provider is doing around that service. And that is something we really focus hard on over the last couple of years. I know in terms of the safeguarding training we've been doing, the information of concern training with our staff, we are really pushing that people have to always remember that we have a responsibility as the regulator. It is not all down to colleagues in the local authority to manage the risks in services. And we have that role as a regulator. I'll particularly reference section 62 of the Act. This came up in the West Sussex Provider Learning Review. We have to remember we do again have that privilege in the legislation of a right to a power of entry. So a care home has to let CQC in. We can, act against them if they don't. It's a really important power. And so I think what I would say is if you are experiencing really real challenges with a provider not engaging with safeguarding and there's some real concerns about risk in the service, that would be a really good grounds to be reaching out to us and saying, we're really concerned about this. We're concerned about transparency. The provider's not working well with us. Please, can you consider that in terms of when are you due to inspect? Because actually it might be that you need to be sharing some information with us and we need to go and see what's going on. And, we can work together in that type of way as well. I have to say it's highly unusual for providers not to let us in. We saw a little bit of an uptick of it during COVID, but that was often for quite genuine reasons about providers being concerned about COVID tests for inspectors and things like that for a little period of time. But it is actually a very rare thing to have an issue.
So you need to say to them that the connection would be great.
Somebody, I think that they've gone up. Okay, so again, just to reference the joint working protocol with ADAS, this is currently dated 2019, but it's what sets out how we should be working with local authorities in those regular info sharing meetings. It's really positive to hear that you've got a weekly meeting going on, because that's even more than what's set out in the protocol, which I think is monthly. There's really good progress happening with that. We've been collaborating closely and we are hoping that the draft protocol is going to go back out to the regional ADAS areas for comment, and by early next year we're going to be able to publish a new refreshed document. And one of the things we've done within that document is to thread safeguarding through it more. It actually currently reads largely around management of provider concerns, more so than also covering that interface with safeguarding. So it's been tightened up around some of that. And we've also added more things about equity and rights and deprivation of liberty safeguards and different things like that. Also for us, really important that we're engaging with safeguarding adult boards. Just for your awareness, this week we've all gone back to sector-based teams. So that's almost like been a rolling back of what happened through transformation, where we went into integrated assessment and inspection teams. As of Monday, we're all now back in sector-based arrangements. So we have teams that are adult social care or secondary care or mental health or primary and community care. They're the four directorates we're back in. But it's really important that we carry on with the engagement with safeguarding adult boards. really important that we're engaging with providers and we pick that up more. Again, that is something that's really important moving forward, that we strengthen those points. And also, again, I would just say, if you do suspect organisational abuse, speak to your local team and bring people in as soon as possible. It sounds, in your area, if you're having weekly meetings, there's lots of opportunity to be able to say, actually, we're quite worried about this service. What do we need to be thinking about together around it? So then, again, I'll jump over this, but just to say, if we see organisational abuse, it's often going to end up aligning with an inadequate service and multiple regulatory breaches. That would be my general experience, that if a service is at that scale of abuse, unfortunately, it generally means they're inadequate, and we probably need to be considering some enforcement action as well. And whilst Regulation 13 is specifically about safeguarding, many of the other regulations come into play. So, for example, with organisational abuse, you often see things hitting people's safe care and treatment. You see a lot of stuff hitting into things like dignity and respect, person-centred care, because it has ramifications across people's quality of care more broadly. And it also has ramifications for how staff are feeling and how staff are being treated in the service as well. Just to explain our enforcement powers, which you'll probably be familiar with, but there are two purposes of our enforcement powers. And one is to protect people who use regulated services from harm and the risk of harm. And that's what we call our civil powers. So this is where we can impose conditions on registration, we can suspend a registration, and in very serious cases, this is where you might see something like an urgent closure. So we do have the powers to be able to directly close a service. There's two parts of the Act that cover that, Section 30 and Section 31. For a closure of a loan provider, that's a provider with one care home, we have to go to a magistrate's court to gain an urgent order to close a service. If the provider's got more than one home, it can be done through Section 31, which does have a lower threshold, but in reality, we apply the Section 30 threshold if it's as serious as a closure. But in all cases, if we're looking at that level of enforcement and severity, we should all be round the table. I do understand ADAS is looking at the Managing Care Homes Closure Guidance at the moment, which is now, it's a fantastic document in my view. I've used it many times over the years, but it is a little bit dated now. So I think getting that updated will be really helpful. But again, if we're in that territory, it's a pretty good likelihood there's some level of organisational abuse going on, and we all need to be working together to safely manage anything where a closure might be considered. We often will try and do that in a managed way if it's necessary, and that can only be done by getting assurances about reviews of individual people, whether individual people at higher risk can be moved. And sometimes closures can be averted if risk can be mitigated in other ways by joint working, with the provider, because it should always be an absolute last resort, because it is, people often have very poor outcomes being moved suddenly from care homes, as we all know. Secondly, we just have around our criminal powers, but that's about holding to account. So civil is protecting people. That's what we do immediately to mitigate risk. But criminal is about those really severe individual cases where people, usually somebody's died, to be honest, we can prosecute without a death, but it's reserved really for absolutely serious incidents that could have been avoided. And as Michael said earlier, one of the big challenges for us is we only get 3 years. So our joint working protocol, the joint working deaths protocol even, is really important, because we should always be investigating in parallel with the police. We shouldn't be waiting for the outcome of the police. And that over the years, quite early on, was a challenge for us, because quite often we were waiting for the police to conclude, and there wasn't necessarily that understanding with our staff that we have to liaise and work together because we're on a time limitation, and you don't want to be out of time by the time the police have said, well, we can't meet our threshold, we're going to pass it to you, and then us be like, well, we've got 3 months left or something like that. It's not ideal, and quite often then we might be able to lose not being, the opportunity to take something forward we should have done. I'll not go into all the principles guiding the use of enforcement because I'm already over, but just to say, and it's really important that everyone's clear on this, we can only enforce against unregistered providers. So that's section 10 of the Act. So that's if you were delivering what meets, the scope of a regulated activity without being registered, that is a directly prosecutable offence under section 10. But the only other people we can prosecute are registered providers. So if it's a company, it's the company, and registered managers. So what people in the public often think is that we can prosecute individual workers within a service, and we can't. It is only the provider and it is only the manager. They're the only two options. So beyond that, we can't do anything further. I'm just going to skip over these two in terms of time. I was going to touch on Winterbourne and Kingswood because they're both quite important ones in terms of learning for CQC, in terms of how we all work together. But again, these will be in the slides and you can read it. But we've done these two rapid literature reviews. And I just wanted to point out that culture is intrinsically linked to organisational abuse. It's often at the heart of everything, because if you've got a good culture in a service, it's highly unlikely you'll see organisational abuse going on. They are really closely together. And these are a couple of points about what culture, potentially is. Again, these are the factors for closed cultures in services. It's always worth revisiting the guidance. This is going back to like 2020 now, but it is really good guidance. I would just stress it can happen in any service. I think it's been used a lot for services for people with learning disabilities, but we're increasingly within CQC referring to closed cultures in hospitals, in mental health trusts. We're doing that more and more, and in maternity, because it can be seen across the board. And finally, just to reference speaking up, and you can see these three particular examples on this slide that are very well known in terms of workers speaking up. Winterbourne, Stafford Hospital, where we had ended up with all the freedom to speak up work that went on, and then Walton Hall. What we've often found within CQC is that it is workers that break through a closed culture. The provider probably won't be reporting what they should be, and it's often us needing to be and really listening to workers. So in Winterbourne View, we were massively criticised. It's quite a long time ago now, but there was a very prominent whistleblower called Terry Bryan who really tried to, speak up to CQC, and we'd passed the information to safeguarding, but left it with safeguarding. And this is back to my point that it is not enough as a regulator to pass individual concerns to colleagues at the local authority and then step away and not follow up. And, again, what I'd ask colleagues working within safeguarding to think about, this is why it's so critical. We start thinking as a regulator about how do we get better at looking at outcomes? Was it substantiated? How did the provider engage with the investigation? Are they demonstrating the ability to improve? Because again, at services like Walton Hall, we saw this loop of provider-led investigations that were very poor. Those issues didn't improve. We're going round and round the merry-go-round, and people are getting abused while all of this is going on. And we have to get better at breaking through that. And then very last point, we did a big review. I was involved in this myself. I led the whistleblowing section of the Listening, Learning, Responding to Concerns review, which I think was quite a brave step for us as a regulator, because it was about being transparent about a negative outcome we had from an employment tribunal from a person who we really let down, a professional who'd been acting as a specialist advisor for CQC. And we learned a huge amount from it. And probably one of my key takeaways is, though, that every one of us has a responsibility, when it comes to things. We can't walk by things we see, often, doing nothing and just walking on by, causes, just as many problems, I think, as, being a part of it. We all have to take responsibility for the part we have to play within things. And part of that for CQC is the fact that we've got, a lot of learning, a lot of things we're working on at the moment that we know we need to do. So thank you very much, and apologies, Michael, for going over.